Right now, sir, this is how the inferior surface of the lever is related. So obviously few things are looking very difficult. Now we will identify one structure at a time. What you can identify here is this is the esophageal end of the stomach. This is the entire stomach. This one is continuing as its pyloric end, identified by the presence of a very hard pyloric sphincter. Now here is basically the rest of the part of the duodenum, definitely, and this particular structure, as you can understand, is the pancreas, and this is the spleen. So obviously we can understand one thing, the spleen will never come in relation with the liver because there is the stomach that is separating the liver from the spleen. What we will do is we'll try to remove the structures from here. As we have removed the structure, what is left here is the inferior surface completely exposed with this structure, that is the right kidney, lying somewhere in relation to the inferior surface of the liver. Now it really doesn't be here like this, it rather stays like this. It is like the pole and the anterior part. You have already seen this in relation with the kidney, that with relation to the right kidney, it is this particular surface that will come in relation with the liver. So you have removed it. So this particular surface of the liver, here the entire structures that are coming in will be somewhat like this, with the thumb representing the esophagus. So this is the groove for the esophagus. You put your finger in the groove. So this entire surface becomes the gastric area or the gastric surface, rightly separated from the liver by what we refer to as the lesser omentum. It is basically connected. So now we'll see how the lesser omentum goes. Now here is your porta hepatis. Okay, you can see that these are basically the structures that are going to comprise the porta hepatis with this. So if this is, so this becomes the greater curvature of the stomach. This becomes the lesser curvature of the stomach. This is the lesser omentum, connecting the porta hepatis to the lesser omentum, to the lesser curvature. So this is the part which we refer to as the hepatogastric part of the lesser omentum. Now, so if my stomach was like this, so this is the pyloric end, here was the gallbladder. Now in this patient, it seems that it was removed, or might be a part of it is present here, we are not sure, but this is the fossa for the gallbladder. If we come here, just beyond this, we know this is where our duodenum is present. That is the first part, and the second part of the duodenum is present because it will go like this. It will go downwards in a curved manner. So this is the pyloric end. So here is the duodenum. Okay. This is my entire lesser omentum. So you can now understand that the lesser omentum is a structure which is connected to both the duodenum as well as the lesser curvature of the stomach. The part that is connected to the lesser curvature is the hepatogastric, and the part that is connected to the duodenum is the hepatoduodenal. So your entire content of the lesser omentum, that we actually refer to as the portal triad, is present in this hepatoduodenal part. So here it is. So here is the gastric impression, followed by the pyloric part. Then we have the first part and the second part of the duodenum, and then the third part goes down like this. Now what about this particular portion? So here it comes in relation with the cause of the jejunum with that of the colon, and here in the uppermost part we have already seen that said there was presence of the kidney. So this is the right kidney along with the right suprarenal gland. Now if we have to identify the rest of the structures, here we have the left lobe of the liver. Here is the right lobe of the liver. This one is the right lobe. Here is a quadrangular shaped liver, and here hidden under all these things, it is really not separated well, we can actually, yes, we can actually see a part of the chordate here. You can actually see a part of the chordate here. If we had a scissor, we could have just, lovely, lovely. What we are right now removing is actually a part of the peritoneal fold, which is holding it in situ. So this is the chordate lobe of the liver. Okay, so this is actually a part of your portal vein. So here goes your chordate, and here goes your quadrate. Now here there are two groups, an upper part and a lower part. So this is separating the chordate from the left lobe. This groove is separating the quadrate from the left lobe. So this is the groove for ligamentum teres hepatis. So this is the ligament teres hepatis. If you hold it, you will be able to feel a cord-like structure inside, which is the remnant of the left umbilical vein. That is the remnant of the left umbilical vein. Now here, the groove between my chordate for C and the left lobe, this is the groove for the ligamentum venosum, containing the ligamentum, the remnant of the, that is the ductus venosus. The ligamentum venosum, which is the remnant of ductus venosus. What was the function of the ductus venosus? It was bypassing the hepatic, because the blood is coming from the placenta. From the fetal growing liver, it will be passing through the left umbilical vein, then through the ductus venosus into the IVC to go into the right atrium of the fetal heart. So if we imagine a line passing through my ligamentum, this groove for ligamentum venosum and ligamentum hepatis, so what will happen is, here we have the anatomical left lobe, and to the right of it is the anatomical right lobe, comprising of the right lobe proper along with the quadrate and the quadrate. Now if we move to the right side, what happens? So here is the groove for inferior vena cava. Here is the groove for gallbladder. We are again joining it by a line known as the cholecysto vena cava line of Cantley. Okay, it is the cholecysto vena cava line of Cantley, and what it does is it divides the liver into a surgical or a physiological right and lobe. So what happens is, this right lobe becomes a part of surgical right, whereas quadrate, caudate and left lobe becomes a part of the surgical left. So whatever is surgical is functional. It means that all the bile that is being formed by this lobes through the right hepatic duct, it will be draining the right lobe of the liver, and through my left hepatic duct it will drain quadrate, caudate and the left lobe of the liver. Same goes for the distribution of the portal vein, and same goes on for the hepatic veins. Same goes on for the hepatic veins. Clear? Understood, sir? So that's in a nutshell about the relations, how we divide it into anatomical and surgical, and what are the various borders and whatever.